The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's session entitled 100 Million Healthier Lives, Transforming Health and Wellbeing for Aging Adults. Before we get started, I'd like to go over a few items so that you know how to participate in today's event. When you joined today's webinar, you selected to join either by the phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce John Feather, CEO of Grantmakers and Aging and moderator for today's webinar. John?
Thanks so much, Lucy, and thank all of you for joining us today. We want to thank, as we always do, the Johnny Hartford Foundation of New York, who for the past 8 years have supported our entire Conversations with GIA webinar series, allowing us to bring this series to our audience free of charge. We also want to thank Philanthropy New York for their sponsorship today as a promotional co-sponsor for today's webinar. The National Council on Aging is leading the Aging Hub of the 100 Million Healthier Lives Project, an initiative convened by the Institute for Healthcare Improvement. 100 Million Lives is a collaboration of change agents across many sectors working to transform how the world thinks and acts to improve health, well-being, and equity across the lifespan. The Patterson Foundation, based in Sarasota, Florida, is an enterprise funder of the Aging Hub, strengthening the movement with thought partnership and connections at the national, state, and local level. Joining us today to share more about the Aging Hub are Deborah Jacobs, who's the president and CEO of the Patterson Foundation, and Jim Furman, the president of the National Council on Aging. We welcome you both. But before we get started, I want to remind you once again that you can enter your questions at any time in the question box that you see in the control panel on the side of your screen. I will be moderating those questions and answers when we get to the Q&A portion of the session. So Deborah, we're starting with you. Tell us a little bit about how you got involved in this process and what we should know about going forward.
Thank you very much, John. And I want to take just a minute to do a little GIA commercial. The Patterson Foundation has been honored to be a member of GIA back from the days with the Engagement Initiative that was originated by Atlantic Philanthropies. And we continue to stay engaged with GIA, so we appreciate our membership very much. And we encourage any other funder who is at all interested in the realm of older adults to become a supporter and a member. But let me give you a little glimpse into the Patterson Foundation on how we think, how we behave, and why we work with NCOA on this particular initiative. The Patterson Foundation is based in Sarasota, Florida, as John mentioned. We work to strengthen individuals, organizations, and communities, and we work through a networked approach with national thought leaders who have their own network, and then we work locally and at the state level as well. And we have actually worked with NCOA on other initiatives, such as the Self-Care Management Alliance and the Aging Mastery Program. When the opportunity emerged for 100 Million Lives, that, again, that's a national movement that Jim will talk about. The Patterson Foundation was interested in helping support the viability of this. And why? The reason that we're very interested in this is because every organization, every foundation, every collaborative has their programs that they work very intentionally on. The challenge is we all measure in unique forms or fashions. So every one of our programs tends to be a success when we have thorough evaluations, but yet we continue as a society to be stuck. because oftentimes people are measuring different things. And the opportunity that's emerging here that we hope people will be intrigued with is if we ask similar questions that have been evidence-based, proven that they work, what's the bigger picture that we might be able to have an impact? So I encourage people as they listen to the depth that Jim is going to explain to think about the work that the participant in the webinar, how does my organization measure and how can I be part of a bigger picture? So Jim, I'm going to turn it over to you because you've got a lot to share with everyone, and I'll circle in later.
Thank you, Deborah. Next slide, please. So let me just also thank GIA, who's been a partner with NCOA on many initiatives, the Hartford Foundation, Philanthropy New York, for sponsoring this, and the Patterson Foundation for being our partners and colleagues as we take on big initiatives. So our goals for today are threefold. First of all, to describe the aging hub of 100 million healthier lives, particularly the why and some of the what, to talk about the progress we made to date and some of our plans, and then to really hopefully begin a dialogue and spark some conversation about ways we can all collaborate for the greater good. Next slide, please. I think many of you may be familiar with the National Council on Aging, but since 1950, we've been working for a just and caring society, which each of us as we age lives with dignity, purpose, and security. And our mission has always been to improve the lives of millions of the older adults, especially those who are struggling. Our strategy, which we've used over the years and we're using very intentionally now, regardless of the issue, whether it's health promotion, evidence-based programs, access to benefits, employment, is to not only talk about what is important, but make sure we're measuring it, to work with national and community groups to innovate and to experiment and curate great solutions, and then take those solutions to scale through either policy changes, working with community partners, and social enterprise strategies, because if we're in the business improving the lives of millions, we have to get to scale with our solutions. Next slide. To that point, in 2011, NCOA set a big, hairy, audacious goal of making meaningful and measurable improvement in the lives of 10 million older adults by 2020. And many people, including board and staff, thought we were kind of crazy to shoot aim that high, but we did without exactly knowing how we'd get there. And I'm pleased to report that in June of this year, 2019, we announced that we had achieved that goal of 10 million people, lives significantly improved a year early. And when we send out the slide from this, we will also include citations where you can read more about the impact specifically and the methodology behind that. But part of what came along with that is not only setting the goal, but going through a strategic learning process and establishing the new goal, which is meaningful, measurable improvements in the lives of 40 million older adults by 2030. We're going to count the 10 we've already achieved, so really 30 million more over 10 years, which really means a 3x increase in effectiveness. And that's all important because at the time that this was happening is when, after establishing our strategy, we met, next slide please, we met the leadership of the 100 Million Healthier Lives Initiative, and particularly Shoma Stout, who was the executive lead of the initiative. And I would kind of call it love at first sight. We were both talking the same language about population impact, about fundamentally transforming the way the ecosystem and the way we all think about improving health, well-being, and equity, taking a view that is holistic health and well-being, not just any particular dimension, and that equity, ensuring that people of all economic, ethnic, geographic boundaries have the opportunity to achieve it. It's fundamental. So there's core alignment, the 100 million healthier lives, has had many partners in healthcare, schools, VA, and faith-based. It's been led by IHI. It's been working across 30 countries. The largest funder in the U.S. has been the Robert Johnson Foundation. And although there has always been an interest in helping older adults to age well, I think our coming in has helped to kind of supercharge those efforts. Next slide, please. So over the last year, we've been working very closely with the 100 Million Healthier Lives and the IHI team to really figure out what an aging hub would look like. And I want to give a shout out to my colleagues at NCOA, Kathleen Cameron, Dorothea Bathiatis, and Helica Herrera-Benson, who have been the three of my teammates who really be doing the work. I get to stand up and take the credit, but they do the real work. And I also want to thank the important initial contribution of funding from the Patterson Foundation, the Administration for Community Living, and IHI itself to help turbocharge this effort. And what I really want to talk about, the reason that we, NCOA, embrace this so fully and why we really see this very strategically aligned is a couple of reasons. First of all, I've been in this field of aging. I'm 68 years old, at least for 45 years. I had a full head of hair at one point, though nobody seems to believe that anymore. But what I think the field of aging needs is a North Star. Why, as Deborah said, we're all working on pieces, but what is our goal? And our goal is not to save healthcare money. Our goal is not just to reduce economic security, that there has to be a bigger reason that we exist. And we believe that holistic health, well-being, and equity really is something that everybody can get behind, and it's the outcomes that we are trying to achieve. I also believe that shared goals and common outcome measures are essential for population-level success, and without them, we are doomed to fail. We can all be individually successful, have nice annual reports, and have nice projects we're doing, but the reality is we are failing to move the needle on most population levels of health and well-being. And if we're not committed to shared measurement, then in some level, we might as well give up and go home, if I may say that a little too strongly. We believe the adult well-being assessment, as modified for older adults, is an elegantly simple, validated, self-reported measures that cover the major domains of holistic health and well-being. And the fundamental hypothesis, which Deborah alluded to, that we believe that if different organizations in different ways use the adult well-being measures, that it will have significant potential for cost-effectively generating actionable knowledge and insights and for fostering collaboration among them. So that's why we're doing this. And the core of this ecosystem is measuring what matters, fostering innovation and learning, fostering collaboration, and scaling what works. Next slide, please. So the work that we've been done that I'll be describing over the next several minutes is what we've done so far in about the last year to adapt the adult well-being tool so it works for older adults, to conduct very exciting initial pilot tests, including in Baltimore and Sarasota, convenings of national partners, and beginning to lay the groundwork and partnership for a much more substantial effort. Next slide. One of the joys of working with the Institute for Healthcare Improvement is the rigor and science at which they approach and challenges and issues. So we work with them to develop a theory of change or driver diagram, which I'm not going to go over in detail right now, but will be in the PowerPoint. But what it fundamentally says that in order for us to achieve population well-being with equity, that we have to focus on what individuals are doing, what the community is doing, what the system of health and social services are doing, and what's happening at the national and the cultural level. So it's within that context that we're doing this initiative. Next slide. And if you take that a little further and you say, what is the state that we need to achieve? We need that individuals, older people, are actively engaged in working toward better health and well-being. that the community supports well-being as people age, that health and social systems are working together seamlessly and effectively to help people age well, and that as a country or as a society, public policies, knowledge, and attitudes are both aspirational and realistic. And we realize that, as Deborah said, all of us are working on pieces of this, but what we need to do is work together much more effectively and collaboratively to have a population level effect, which for us is hopefully helping at least 40 million people age better by 2030. Next slide, please. So the group that this initiative is really focusing primarily on is that first domain of the whole person. We believe that it's also, that focus is also relevant for the communities and for health systems and society. But what we're really seeking to do is to improve holistic health and well-being, and that there'll be at least 5 conditions that are happening in people's lives, and much more than there are now. First of all, people who are self-reporting and understanding well-being in a broad holistic sense, and I'll go into that. Secondly, that people have the education, training, and support for healthy behaviors and self-care so they can effectively do this. Third, that people will have financial resources and solutions to deal with what are going to be dire economic conditions for perhaps as many as 60% of older people. That concomitant with that, people have opportunities to continue to be meaningfully engaged, whether it's work or volunteering or other forms of contribution, and that there's ongoing planning and discussion for what life transitions, which are whether it's increasing frailty or advanced care planning happen. So those are some of the things that we seek to measure and to change at a population level. Next slide, please. At the core of this is a sense of the adult well-being assessment. And the first thing to be noted about it is it says that there are dimensions to well-being, that if a person is going to have overall well-being, that's going to be made up of at least their physical health, their financial well-being, their mental health, their social well-being, and meaning and purpose in life. And that these are all dimensions which are important, which data suggests if you're not doing well in one of these, it's going to affect your overall well-being, but that we need to begin by saying what matters, overall well-being, and then we wanted to build on the work of IHI in terms of measuring it. And the IHI has, Institute for Healthcare Improvement, has put together a very impressive team of researchers, including Britta Roy, who's the head of population health at Yale Medical School, Carly Riley from Cincinnati, Matt Stiefel, the director of population health at Kaiser Permanente, who teamed up with our expert, Angelica Herrera-Benson, to look at how do we adapt this tool for older adults, because it was a general tool for 18 years and up, and they asked us to look at it. And in the course of our work in Baltimore and focus groups and testing things, we made two changes to the core 7 questions that they had. The first was that at the overall question says on a scale, basically on a scale of 1 to 10, how would you rate your overall well-being? And the second question was, what do you think that rating will be in 5 years? What we learned was 5 years is too far out for older people, and that they don't think that far out, but 2 years. So we've now modified that second question to be, what do you think your overall health and well-being will be in 2 years? And they also, when we looked at the scales, IHI also asked us to see what was missing, and what we felt was missing was a question related to loneliness or social isolation. And fortuitously, thanks to the Margaret A. Cargill philanthropies, which had convened working groups to look at the question about how do you measure quality of life and social isolation, there was a parallel effort in which we were also involved. The National Opinion Research Center, at our urging, came up with a question which addresses loneliness and social isolation, which is great because now I think all the literature recognizes the importance of it. So what's unique and different about these measures is that they're holistic, that they're validated self-reported measures. There's science behind the fact what people say is useful and important, and that when you talk to people, whether they're individuals or community organizations or healthcare, remember these measures came out of one of the leading healthcare innovators in the country, it resonates. We believe that it's a cost-effective way to measure status and at the population level, whether you're looking at a person's looking at themselves or looking at the clientele for a senior center or looking for a community at the community or in the national level. It's not the only measures. You can link it with other measures. But the idea is a pretty simple one. If you want to know how well people are doing, ask them. If you want to get insight into what's really going on, ask people. It seems like kind of a simple thing, but it hasn't been the norm. So we're very excited about them. Next slide, please. And that what we wanted to talk about now is we tried to take this excitement, share this around, and begin to talk about how it could be used in different settings. So I'm going to describe two and a half the projects, the Baltimore project and the Sarasota project, and Deborah's going to talk to that, and I'll briefly touch on the emerging project in the Massachusetts community. Next slide, please. So the earliest adopters, and I want to give a shout out to Jill Hall and the Baltimore County Department on Aging. About last summer, we met with the Senior Center leadership from the National Institute of Senior Centers and talked about this project to see whether there'd be any interest. And they were all interested, but Jill Hall was more than interested. She said, no, I really want to do this. And I said, that's great. She said, I really want to do it. And I said, terrific. She said, no, you don't get it. I'm going to do a survey of all my senior centers in October. Give us the questions, and we'll put them into the field. So they really are the pioneers, the first people to use this. What our commitment to them is working with them over 3 years. So they did the first survey in October. We got the data and analyzed it in January, February. They'll be launching another round of the survey beginning about a month. What I want to say is it's a treasure trove of data, because all of a sudden you are able to get different insight into people in different ways. And I've only got one slide here, but I want to give you a sense that there's a lot of really interesting things. For example, we found that life satisfaction and life optimism do vary by living arrangement, and that people who live alone are happier than people living with their children, which is kind of an interesting thing. And that we also saw, for example, that when we looked at crises by different ethnic groups, the group that substantially had the most reported the highest scores on meaning and purpose in life were African American, followed by Hispanic, and Caucasians and Asians were significantly lower in meaning and purpose in their life. We found also that there was a correlation between finances and overall well-being, and we're still analyzing the data, but it's not always the intuitive answer, and it's also great insights at the population level. But was perhaps even more interesting was the fact that looking at the variations among senior centers that we saw. And what you see here is among the various senior centers, at the one end, 68% of the population said they were thriving, which is a conglomerate of the different scores, and 30% said they were not. And this was kind of an eye-opener for the center, for the Department on Aging. And as a result, they are paying greater attention to the centers with the lowest scores and targeting more programming and resources to see if they can improve them. They're looking at specific things. For example, a few of the senior centers reported lower scores in overall health, and those also happen to be the ones that didn't have gyms and gym equipment. So now they're going to be moving into more of those kinds of things. They are beginning to also encourage people outside the senior center population in the health department to use them and with others. And as the database grows, we'll be comparing them to other senior centers. So as a sense, in terms of insights and actionable data, we're still early on, but it's quite promising, and what we're seeing is tremendous interest among other senior centers as a result of that. We'll have a lot more of the specific findings in another few months to be able to share. At this point, I'd like to turn it over to Deborah to talk a bit about our other leading pilot community, Sarasota County.
And so change slide, please. So I want to give a shout out again to GIA, because again, GIA for years has helped communities who are working in the age-friendly space to connect and learn from each other. And the approach that Sarasota County took on this assessment was through the age-friendly lens. And I do want to give a shout out to Deborah Govro. Her face and her contact information will show up on the how to stay in touch with us slide. So you'll get to see who she is later. But let me just take a second and talk about this age-friendly connectivity. So Sarasota County embarked on the age-friendly journey. We were the first community in Florida to do so, and we approached it from the standpoint of how to engage individuals, business, nonprofit, government, and media. And we now in Florida, there are 31 age-friendly communities. But not only are there age-friendly communities in Florida, but there's also age-friendly health systems. And shout out to Hartford for their support of creating age-friendly health systems. And there are also there's age-friendly health systems, hospital systems, and age-friendly public health systems. So we have a very enlightened public health administrator in Sarasota County, and he was willing to work with us to embed the questions that Jim has just described for everyone in the assessment that they do every 5 years for their accreditation requirement. But then so it was part of his assessment. We also work with our health system, that's one of the Hartford age-friendly health systems, because they do, public health systems do assessments, and they also are using the questions. So we have the multiple entities. We have age-friendly has to do their every 5-year action plan. So we're embedding the questions in age-friendly. We're embedding the questions for the age-friendly public health system, and we're embedding the questions in the public the public and hospital health system. I'm sorry, I'm making those sound confusing, but there are two different entities. So by asking the same questions, everyone will have the data that will come back to them that they will use in their work. We're currently evaluating the data, so I don't have statistics to share, but I wanted to suggest that anyone listening on this call, think about what your ecosystem is and what you measure and who else might be measuring things and how you could do it together collaboratively so that you can share outputs as they come out. So I just encourage everyone, if you're in the age-friendly space, think about, is there the opportunity through your public health age-friendliness, through your health care system age-friendly, or your community assessment plan to use the questions that come out of the 100 Million Lives Aging Hub. Jim, actually, I was just using the system approach, so I'm going to send it back to you.
Thank you, Deborah, and I want to commend you for Sarasota for its leadership of a local project of national significance. Thank you for that. Next slide, please. So as we're thinking about, we think there are a lot of ways that this adult well-being assessment can be used. And as Deborah said, we encourage you to think about which might work for you and your communities. Again, our basic premise is that this data can provide new information, actionable insight, and foster collaboration toward common goals. So one thing, for example, is that we are now experimenting with that at our Age Plus Action Conference. We had about 1,000 people, and we asked them to try to take these conversations back into their communities. And by that, we gave them 2 discussion guides, one on what is using the questionnaire and what does aging well mean to you and what could you do about it. And a second one really doing what is aging well for all, conversation starters focusing on adult well-being and the fact issues of equity, equality, justice, and inclusion. Because it has to make sense for individuals, and I've done it with my family at the kitchen table. It really does work. We'll also see the senior centers, and there's great excitement among the senior center community and other CBOs. It's a different way to know your clientele. You don't know what's really happening unless you ask them in this way, and I think you may be getting a glimpse from Baltimore. They're really jazzed, and other senior centers are really eager to do this. We also believe that these measures, combined particularly with social determinants needs assessment, can be a way to create better linkages between health systems, health plans, and CBOs, community-based organizations, to understand where people's pain points are and what can be done to address them. Because even though we may be working on a specific thing like improving the outcomes of medical care or improving transportation, at the end of the day, it's about overall well-being. As Deborah has mentioned, age-friendly communities, a terrific effort, mostly, in my opinion, focused on outputs, not on outcomes. And it seems to me that a community needs a North Star. Why are we doing all these things? Because we want to improve health and well-being. It's also, we believe, a real power of this is at least using some shared measurement when it comes to research and outcome measures. For example, right now, there's a big buzz about social isolation and what can we do to reduce social isolation. Yet, if some people are using the Duke scale and some other people are using the UCLA scale and other people are using 4 or 5 different scales, without any common linkage of metric, we have only achieved a small fraction of the potential. So what we're suggesting is that people can still use whatever scales they want, to make sure you at least do the common question of the loneliness, social isolation question, which will at least allow for a basis of comparison and learning. We also believe that we have many senior centers and others that are collecting this data. It'll make it much easier to learn. And also this data we know we believe, and there's evidence from IHI, can influence policy decisions. But what I want to say about all of these things, individual centers, health systems, age-friendly communities, research and policymakers, the grant-making community has to show up. The one group that is, in my opinion, can help make this happen is by promoting, encouraging common use of these measures. And as ambitious as we are, we believe that Grantmakers should recognize the special opportunity and the need that they have to help pull this out in whatever way makes sense for you and your community. Moving forward, we've also been, next slide please, we've also been working at the federal level to talk up these issues. And in April, we had a meeting, IHI and NCOA, with several federal agencies, ACL, the Office of Women's Health, Transportation, HRSA, and many of the leading national organizations, NACO, the Association of Area Agencies, Advancing States, Leading Age, Meals on Wheels, ARP, Grantmakers and Aging as a colleague, and the Patterson Foundation. Next slide. And we spent a day talking about this initiative, and I think what came out of it, first of all, there was an optimism, a sense that we really could work together, and that having an inspiring vision, it would be possible to change the narrative. There was also a great desire and a recognition that this is a way to bring the voice of older people and caregivers into the conversation. If we are asking them how they're doing and we're measuring it and reporting it, they are defining and telling us how they're really doing. And that it's a tool both for understanding aging well and for equity. There's a great recognition that the social determinants and behavioral determinants are the things that are going to affect this, and a real opportunity to work together, desire to go deeper on the work. So we're very pleased by both the initial pilots and the interest and momentum at the federal level. Next slide, please. So where we are now is really laying the stage for the next phase of work, which we're envisioning is a 3 to 5 year phase. We're very much in the planning phase, but what we know it's going to include is this commitment to shared measurement and shared outcomes, and the desire to move the needle on the population level, whether that's in the level of your senior center, your community, or your state or the country. We see opportunities to work both with model communities where each community adapts this in their own special ways, and we learn from that. We also see very clear opportunities to work through our national organization partners, Leading Age, N4A, NACO, any of them, to identify early adopters and innovators and spread them through their networks, and also that then to foster learning, rapid cycle innovation, etc. So we're in the planning stage, and part of this having this webinar today is to put these ideas out there and to see where there might be some interest, questions, and hopefully making this movement larger as we work collectively to figure out how to define what matters, which is holistic aging well, measure it using elegant, validated, self-reported measures, using those premises as a basis to spur innovation and learning about what really works, and then working together to scale what works through social enterprises, through community action, and through public policy changes. So that wraps for this part. John, I'd like to turn it over to you.
Well, thank you very much, Deborah and Jen, for your wonderful presentation about this important project. A reminder that you can enter your questions into the question box at any point. So at this point, I will start with a few questions, and then, but please keep adding them as we go. So the first question, and this could be to either of you, how can we access the questionnaire and the materials that you've talked about, and also will we receive these after this presentation?
This is Jim Dell. I'll take. So actually, 2 more slides up, we are going to provide 2 links. One is to a GIA website at GIA, and the second is at NCOA, which will have more details about the questionnaire and various resources. In addition, we will be sending out to all of the participants this deck along with a questionnaire for more feedback about people's potential interest. We will also, at the end, be providing email addresses both for me and for Dorothy Abatiadis, as well as Deborah Jacobs and Deborah Gavreau from Patterson. So if there are individual questions, we will follow up on that.
Deborah, anything to add to that?
Nope, that sounds good. What we're looking for is, there's no question that isn't going to be welcomed. So if it's not now, then we definitely hope people will connect with one of the 4 of us afterwards.
All right, thank you so much. So the next question is a more specific one about another organization, national organization, that also has survey questions and so forth. And that's about NASWAD, I always get this wrong, but I think it's the National Association of State Units on Aging and Disability, which has the National Core Indicators for Aging and Disability survey. And you know, as you know, there are many of these as well. So to what degree are you already aligning those kind of questionnaires with the work that you're doing?
That's a great question, and we met early on with Martha Roherty, who's now, NASUAD has a new name, Advancing State, and we both recognize that groups do have different questionnaires. I believe their focus is more on, long-term care and long-term living issues, and we view this as potentially complementary because it's focusing on other aspects of well-being. And so, for example, organizations that may have a deep interest in helping people to be able to remain in the community, not in a nursing home, that's about what they're, as far as they're able to go without also looking at some of the other dimensions of quality of life. So all of these cases, this isn't necessarily going to replace other databases, but it should be complementary, and we would encourage the folks at NASA at Advancing Faith to see how this might be used as complementary measures in appropriate situations. And the other thing I'll say, we know that helping people stay out of nursing homes and stay in the community is something that would likely have an impact on their overall well-being scores. So we can use these measures to be an additional measure of the potential benefits of any other type of service or program.
All right. So this question is around how the survey is actually used in terms of the assessment. Is this an in-person survey, or is it done by question and answer remotely, or how is this actually done?
It can be done in a variety of ways. In Baltimore, they had an annual assessment they did anyway, so they basically added a page, people, and then they had people enter in the data. We are working with a group in the third pilot, My Senior Center, which is working to have a way that this can be incorporated into the software of roughly 1,000 senior centers around the country that use My Senior Center. It could be done via a website. It could be done on the SurveyMonkey. There are a variety of different ways that can be used to collect the data. And right now, all of that data isn't necessarily all coming in to one place. But you know, that's aspirational down the road. But right now, people can use this in any way they want. In some cases, small senior centers have just used it as part of their casework intake to get some insight, again, about how people are doing in ways they might not know otherwise.
So here's a pretty broad question, and that's the issue of what are the both the benefits and potential drawbacks, but also the obligations to joining with you in this project. I assume that probably includes cost, and why is that more advantageous than continuing our own independent efforts?
Great question. Let me answer the second part first. We are where we are as a field because we don't use shared outcomes and shared measures. So if we are happy being satisfied with, you know, being good organizations, but not moving the needle at a population level, we don't have to commit the population metric. If I would say, and this is not just funders, this is all of us, if we are serious about moving health and equity at a population level, we have to measure health and equity at a population level, or we're just not going to get there. I think this is about recognizing, as the example I gave before, if 20 of us are measuring social isolation in different ways, and there's no way to say that, other than say, I was statistically significant on one scale and you're statistically significant on another scale, if there's no way to compare information, then we limit learning. If we make it incredibly expensive, which it is right now for a senior center or an organization to do an intervention study, which typically, because they can't collect outcome data, we hinder the ability to move forward. So I think it's a level of seriousness. Having said that, people can still do what they want to do, just look for the common links. In terms of the question of cost to participate, right now there's no cost to take the questionnaire and start using it, which is a good place to start. As the initiative unfolds over the planning phase, and we really roll out the 3 to 5 year plan, which we will in the next several months, then there may be opportunities for funders that want to fund model communities or network projects. But right now, we don't have a price tag or business plan. This is much more about who's really interested, who sees value, and who really wants to help us co-create this, because it's not like we have the answers. We just believe we have some of the tools and that can help us get to a solution.
We have several more questions. Oh, sure. Go ahead, Deborah. I'm sorry. Okay. We have several more questions, but I want to turn to the next two slides because many of the questions have to do with where is the material. So if you would go to the next slide, and Jim and Deborah could talk about this one and the next one, then we'll come back to a couple final questions.
Yeah, and Jim has actually talked, the slide that's in front of everybody right now on the Learn More, Join the Movement. These are the links where you'll be able to dive in a little bit and explore. But the previous slide, so I would suggest anybody that's on this call, you're going to get the link to the whole PowerPoint unless you're writing very quickly right now or doing a screenshot. Go in and explore on either the GIA website or the NCOA website about this. And then the previous slide in this deck, you've got the email addresses of 4 people who stand ready to help you navigate, understand, answer any questions you have. So you both have that way to explore on your own, but know that there's people that are welcoming your participation questions. You may have questions that haven't been thought of before, but likely we're all going to learn as the journey continues.
Jim, anything to add?
No, I just want to, I guess, wrap up. Is this to wrap up, right? It's just to say that this is bigger than all of us, bigger than any of us. And for us to, all of us in this field, whether we're funders, whether we're researchers, whether we're in social service agencies, are here because we have a passion for improving the lives of people. And for improving the lives of as many people as we can, and for making what's cool about this field, it's not just about them, it's making life better for our future selves. And we have to realize that in order to be effective, given the enormity of the issues, that we have to work together in more powerful ways, that we have to have a shared vision and goal, which we think population level health, well-being, and equity is that. We have to have shared measures to know how we're doing, and with that commitment and shared measures, we believe we can unleash a new era of innovation, learning, and collaboration. And so that's why we're here. That's why we are so vested in making this work. But it will only work if you join us and help it make it work for your sphere of the world as well.
Deborah, how about you?
Yeah, can I do just a quick little commercial for an in-person? I am going to be at the Grantmakers and Aging annual meeting that's coming up in October. So if anyone else on this call or your colleagues are going to be there, I'm happy to do a face-to-face conversation about this and help you connect in a way that would be most helpful for you.
Thank you. At this point, we want to bring this to a close, but I do want to remind everyone that we will be sending you at the end of this both a short survey, but also a link to all the materials you have in the slides, but as well as the actual way to get to the questionnaires themselves. There's obviously a lot of interest in this. It's very exciting work, and we want to make sure that everybody can participate as we go forward. So at this point, I want to really thank Deborah Jacobs and Jim Furman, longtime colleagues of ours who continue to do great and innovative work. We want to thank you for all you do to make life better for older adults and people of all ages. I also want to thank the Johnny Hartford Foundation for their support of this webinar, and to Philanthropy New York for their promotional support. We will, as we always do, make these presentations available to anyone who wishes to view them later, including both the slides and the audio, You can find the access to that in an email to be sent to you in a few days, but it's always on our website, and it has the list of the complete series going back a number of years. We also want you to join us for our next conversation with GIA, which takes place Thursday, October 3rd from 2 to 3 p.m. Eastern Time. This webinar is entitled Intergenerational Programming in Senior Housing, From Promise to Practice, and we'll detail an exploratory study conducted by Generations United and Leading Age LTSS Center at the University of Massachusetts, Boston, which was funded by the Retirement Research Foundation to better understand the range of intergenerational programming in senior housing. And finally, we want to thank all of you for participating in today's webinar and all that you do to make life better for older persons. Have a great day.